Hi, welcome to Ask Dr. Tan. So this is a program that we're doing that every week we gather all the questions from you, our audience on the internet about these medical questions, and then we pick the three most popular ones and then we try to answer them as best as we can. So for this week, our topic is on circumcision, a very popular topic. And the most common question that we got was, can you cure fibrosis without removing the foreskin? Okay, so fibrosis is a tightness of the foreskin, right? So the answer to this question is what is actually causing the fibrosis. Now, if the fibrosis is physiological, that means if you're born with a tight foreskin, you actually have a lot more options. You can undergo full circumcision, remove the whole foreskin. You can undergo a limited circumcision, which is just removing a partial part of the foreskin, or you can undergo a preputioplasty, which is a surgical technique that we use to loosen the foreskin without removing any skin at all. But if your fibrosis is due to something more sinister, like infection, balanitis, inflammation, BXO, or warts, then you really might not have the luxury of so many options that you might just have to go for a full circumcision. So really, whether or not you have to remove the entire foreskin to cure your fibrosis is something you have to go see a doctor and ask him about. Okay, what types of circumcisions are there is the second question. I think this question is more asking what are the different surgical methods for circumcision. Right now, there are lots of surgical methods out there. There's conventional, you can cut the skin with a laser, with a blade, with scissors. You can use devices like rings to guide the removal of the skin, right? You can use different methods to close the skin after you remove the skin, like the plastic rings also keep your skin closed, or you can use stitches or staples. So the important thing is to talk to your doctor and ask him what is the technique that will best suit your needs and your wants. Right? If you want to achieve a certain aesthetic look, what's the best technique? And also talk to your doctor about his experience in all the various techniques, because you really want your doctor to be comfortable in using his particular technique on you and making sure that that technique can achieve what you want to achieve. Right? So, will circumcision improve my sex life? Oh, this is a very good question. So, a lot of the data that we have currently reports that circumcision actually improves sexual performance. That said, there are also anecdotal reports from patients who say that some circumcision can cause reduced sensitivity of the glans penis on the head. Right? Obviously, like any other surgical procedure, there's always potential risks and complications. You really need to understand this from your doctor before you decide to proceed or not. And okay, that brings us to the end of this week's session. All right, I'll see you guys next week.